Assalamu alaikum. A patient came to the clinic a few days ago and she have an impacted canine. So she was asking me, can you pull the canine as much as possible? So I was pulling the canine with a power chain, but she said, Doctor, stretch it as much as you can so it will come out faster. I was reading the orthodontic current principles and techniques. And in chapter 4, I saw a very nice paragraph under the title bone cell modeling that enables tooth movement through the bone. It was a very small paragraph, but I think it summarizes the biological tooth movement. It's a very small paragraph. So Wise and King, they focused their study on this field, on biological tooth movement. They found out to initiate the biological response that recruit and initiate osteoblast and osteoclast, we need a force. So if we took their study and we related it to the phases of orthodontic tooth movement and to the underlying biology, we will find first the tooth will move within the socket. So within the socket the tooth will move. And then there will be a delay, 1 to 2 days. What happened in these 1 to 2 days? The cells are still sensing what is happening in the environmental. So there is an environmental change because of the force. So they are still sensing and they are sending signal. We have two options. Option A, that we have a light force in which after 2 days, we have a linear tooth movement. The osteoclast will go to the compressed side and it will start its activity to resorb. And the osteoblast will go to the tension side. And then we have bone formation. And then we have a very nice continuous tooth movement. On the other hand, option B, we have a heavy force. So when we have a heavy force, this delay will be there for several days, many days. Why? Because the blood capillaries are closed. So when the blood capillaries are closed, necrotic tissue will start to form. So there will be necrosis there. After several days, then we have a linear tooth movement. Now, this linear tooth movement is there because when we have a necrosis, the macrophage will be activated. So the blood capillaries will open, oxygen will be there, macrophage will be sent to dispose the necrotic tissue. And that's when the tooth movement will occur. It will be a very short time. So this will help, this small video will help the students in the ortho or even the dentist to understand that whenever we are moving the tooth, we need to apply the minimum force possible. We want the optimal force, and the optimal force is very little to move the tooth, and that will move the tooth even faster. If we add more force, then what we are expecting is that the tooth will not move. We will find a very little movement. I hope this video summarizes biological tooth movement. Thank you so much.